I always find it amazing to see how enthusiastic the students are about their learning, but also how enthusiastic the teachers are. And it's that combination that I think really helps us have faith in the future for the doctors coming through the system.
Medicine. Groundbreaking medical research and high-quality medical education.
When you teach, it also gives you an appreciation for the other things, especially when you teach students at different stages. And I had medical students with me on one occasion. They were a couple. One was a second-year medical student, and one was a fourth-year medical student. But this was not known to the patient in the bed, of course. And we were doing rounds one morning. He was very ill, very near the end of his life. And we were hoping to get him back to the nursing home with his wife. I asked him, was there anything else I could possibly do for him before he was discharged to make everything more smooth and more comfortable? And he looked at me with these two students in the room and he said, Dr. Graham, I have had the best life. I have wonderful children. I've lived 40 years with the most wonderful woman that I would choose to marry over. There is nothing in the world that anybody else could do to make my life better. I appreciate everything you've done, but I need to get home to be with my wife, and that's really all that I need. And I could see this medical student tearing up in the corner, and it was very sweet because she was there with this man that she's going to marry. And it was just very, very touching and very nice. And I think lots of times students, don't get to hear that. This man, even though we couldn't do a lot more for his health, he was the happiest man alive.
Education and research, and together that can impact on clinical care and improve the care for patients. First and most important here in Newfoundland Labrador, but much of our work has universal application throughout the world.
The ARVC project for me started with a bang, and it started on a Friday afternoon when I was called down to the autopsy room with Dr. Simon Avis and Kathy Hodgkinson. And Kathy showed me a heart of a young man who had just died over the weekend. He was 43 and dropped dead in front of his two sons. Not only did I know it was a human heart, I also knew it was a human heart affected by ARVC because it was exactly like they describe in the literature. One side, the left side, was all red and looked like a heart should, and the right side was gray. Fat and fiber had replaced those nice muscle cells that should have been there. So Kathy looked at me and said, so are you going to take on this project or not? I said yes, and I walked out of there in tears. Our lab went full scale and we identified all the families that were at risk. We looked at chromosome 3, we sequenced 20 genes, bango, we had it. It's made a huge impact. And we were invited to the European Society of Human Genetics meeting just a couple months ago to present the results of this research. It's a huge success and it's been a real pleasure to work on it.
Our medical school is the best I know of in the world at producing doctors for a small rural region. We've just won an award by the Society of Rural Physicians of Canada for having the highest number of students that choose to train to do rural practice as a residency training program.
I came here as a med student and went to a small community on the southwest coast, not accessible by road, only by ferry or by helicopter, called Lapoille. And we went to Lapoille as a medical student, and I noticed that everyone there was very concerned about their isolation, and so much so it was impacting their health because they were worried about any health risks. If they had the smallest pain at all, they were worried it was a heart attack, and if you have a heart attack in Lapoille, it's hard to get out, and you may not, and that might be their last pain ever. I suggested that they train people as first aiders in Lapoille. Just find a couple people, give them the training, and give them equipment, including first aid kits and automatic defibrillators, which would be kept at the medical clinic. And then I came back as a resident, and we got a phone call one day that the first aiders in Lapoille had been called out to a lady's house who had collapsed and was unresponsive. And so as a resident here, I asked for a chopper to be called because there was a chopper down the coast doing a clinic, and they came and picked me and a nurse up, and we went down to the house where the lady had collapsed and was still unconscious, and the first aider was there doing their thing, and we stabilized her in her own home and packaged her in a stretcher, and we managed to get her back to the helicopter and flew her back to here to Port aux Basques, and she did well actually, and she stayed in hospital for a little bit, had some investigations, and she's been doing fine ever since. And so that was one of the episodes that made me convinced that this is where I wanted to practice.
Well, for me, it's just so exciting to be able to help guide the medical school and lead the medical school into the next stage of doing what we've done well, to do it even better, and to expand our medical school to give more students a chance to get into medical school and become doctors for here, to encourage the development of our research enterprises so that we can do more research that makes a difference to people in Newfoundland and Labrador, and putting all the many facets together in what can be described as a very complex job is what I find so very rewarding.
Memorial University Faculty of Medicine, growing to meet the demands for quality healthcare.